Hello and welcome to Nature Source Care. My name is Dr. Funda Goldman. I'm a naturopathic physician, and today I was going to talk about Marma Therapy, Ayurvedic energy points on the upper back. So a note of caution before we get too deep into this. The information presented here is for educational purposes only and should not be considered medical advice. For any symptoms that are severe or worsening, please contact a qualified healthcare professional. It's always important to determine the root cause of any disease and to develop a comprehensive treatment plan, of which Marma Therapy can be a part. Individual cases can vary in terms of treatments that are most effective, and solo therapies may not be appropriate or effective in all cases. So sometimes Marma Therapy by itself really won't help much. So keep that in mind. Just a few words about Marma Therapy generally. If you haven't heard about it before, it comes from Ayurveda, which is traditional Indian medicine. It's more than 5,000 years old. I particularly like it because it's not invasive. It doesn't use needles the way acupuncture from traditional Chinese medicine, that paradigm. It is an energy therapy. There are 107 Marma points on the body. So when we talk about energy therapies, you want to start wrapping your mind around the idea that people, diseases, states of health are all energies or waves. And so when we stimulate these points, we're helping to rebalance those energies or waves. Yeah. So the thing is that the touch used in these therapies are really quite gentle in nature. If you come from more of a biomechanical or biochemical paradigm, sometimes in those paradigms, it's like the more you do, the more you push, kind of the more result you get. That's not necessarily true here. It can actually be counterproductive. So easy does it. And if you're interested in more history, I would check out my first Marma video, Marma Points on the Hand. And if you want an example, a follow-along example, so you can kind of, treat yourself and have an experience of it, I also created a Marma Points on the Hand follow-along video, so you can check that out. And then the other thing is, since we're talking about Marma Points on the upper back, I've already created other Marma videos, Marma Points on the back of the neck, Marma Points on the shoulder and upper arm, and Marma Points on the chest. And actually some of those points are related because, again, you're going to have overlapping regions. So you might check those out. And then if you're interested in this kind of content generally, I always organize my videos into playlists, so you can check out Marma Therapy, Ayurveda, or Body Care playlist to find more content like this. So I wanted to go through just a brief review of upper back anatomy, because one, it's hard to see it on yourself, but the other thing is that if you're working on somebody else, maybe you're a healthcare professional, sometimes, depending on the person's anatomy, some things are easy to see and some things are not. So let's just do a review here. So you can see here, this is somebody's back, and right at the top midline at C7, there's a blue dot. That's actually a point, Marma point called Manya Mani, which I covered in the back of the neck video, my Marma Points on the back of the neck. So I'm not going to cover it here, but it is, again, the sort of overlapping region between the back of the neck and the upper back. So I just want to put that there for context. And then also, if you look to laterally from there, but a little bit lower, kind of in the midpoint of the trapezius, upper trap there, you'll find skanda, that Marma point skanda, which I covered in my Marma video, shoulder and upper arm. So if you have shoulder issues, you might look at that video. But then these other 5 dots here, these are the ones we're covering today. So you can see right, just lateral to the midline spine here, you have 3 points, kind of all together, one on top of each other. They basically they sit on the spinous process of T3, T4, and T5. Yeah, so those 3 vertebrae. And there's it's bilateral. So actually the prishtas, these are called prishtas, you have 6 of these in total. Okay. And then the next point we're going to talk about, again, just so you have some context, it's called Amsa Phalaka. And this sits in the middle here of the infraspinatus fossa of the scapula. So if the scapula is kind of like an upside down triangle, very broadly, and then you have this sort of diagonal line here, that's the spine of the scapula. And then below that, you sort of have an upper 1/3 fossa, sort of like a valley. And then the lower 2/3 is another valley that's lower 2/3. It's called the infraspinatus fossa. So right in the middle, between that spine and the lower angle of the scapula, that's going to be your 4th point, Amsa Phalaka. And then the very inferior angle, the sort of sharp point at the bottom here, that's going to be your last point, Bruhati. Okay, because again, when I show you photographs, it's not, this is very clear, but most people don't come in looking like the textbook. Just so we know what we're aiming for, but again, you're going to have to, if you do work with people, you're going to have to determine from their anatomy, because everybody's a little bit different, where exactly these points are, but that's what we're looking for. Okay, so the first set of points, the prishtas, and there are 3 of them. And again, there's 3 on one side of the spine and 3 on the other side of the spine, so 6 in total. Prishta means back. These are also called the amshas, which means between the lungs. So 2 names for the same points. Okay. So again, I mentioned briefly that Prishta 1 sits at the spinous process of T3, so the 3rd thoracic spine or vertebra. P2, so Prishta 2, sits at the spinous process of the thoracic vertebra, the 4th spot there. And then Prishta 3 sits at the spinous process of thoracic vertebra 5, right? So they sit, unless somebody has a deviated spine, they should mostly sit right on top of each other. So again, 3 points on each side, 6 total. The energies associated with these points are the Pranavayu, Udanavayu, Vyanavayu, Sadhaka Pitta, and Avalampaka Kapha. These terms may not mean much to you unless you've studied some Ayurveda. These are different sorts of energies in the body. I'm not going to go through them deeply here. I have on my list to make videos about them, but it's not going to happen here. But just as an example, Udana Vayu, for example, that's the energy in the throat. So when you have movement, right, wind and breath going through your throat and vibrating through your vocal cords, and you'll get speech. So, and Vayu means wind. So when you don't have that sort of wind-like energy, there'll be problems with speech, or deviations in that energy. You'll have problems with speech. So just as an example. Now these Prishta points, they're indications. So they will help with the throat. So things like coughing, yawning, sneezing. They'll help with the chest in general, so things like pain and congestion in the chest. They'll help the heart, so angina, pain, AFib, atrial fibrillation, heart flutter, palpitations. These things can be helped with these Prishta points. The lungs, so things like chronic cough, shortness of breath, asthma, bronchospasm, and congestion can be helped with these points. These points, because they're sitting close to the heart, and the heart in Ayurveda is the seat of thoughts and feelings, and also these points are related to Sadhaka Pitta, which is sort of the fiery energy of the mind. These points can actually be helpful with calming and releasing emotions, and also insomnia. So especially Vata and Kapha type emotions. Vata is wind energy, Kapha is earth energy. So Vata emotions are things like anxiety, being overwhelmed, feeling scattered, feeling ungrounded. Kapha is more like earth. So people who have Kapha type feelings that are unbalanced, they can actually get too attached. So they can, kind of get into this greedy state. The other thing is that they can feel depressed. Their mind gets too heavy, their feelings get too heavy, and they have a hard time digesting those feelings. There are differences between these 3 points, even though they're very close to each other. So Prishta 1 is more related to the heart and lungs. Prishta 2 is more related to the trachea and bronchi, so kind of the upper part of the, upper and deeper part of the lungs. It's also related to Agni, which is the digestive fire. So digestion can be helped with that point, P2, Prishta 2. And Prishta 3 is related to pain that's heart related, so cardiac related pain. And if you find somebody who has nausea and vomiting and pain at this point, that might be an indication that they're actually having a heart attack or myocardial infarction. Yeah, so this is a very typical pain place for people to have pain when they have a heart attack. So those are the Prishtas or Antaramshas. So the next point, which is by itself, there is one on either side, so it's a pair. You can use either scapula to stimulate the point or both. So the location, let's go through the name first. So this is called Amsha Phalaka, which means the lung switchboard, so controls the lungs, And the location is again in the right in the center of the infraspinatus fossa, the midpoint of the scapular line, and the inferior angle. So the energies associated with this point, the pranavayu, udana-vayu, vyana-vayu, sadhaka pitta, and avalambika kapha. Indications for this point are prana generally. Prana is the life force energy in traditional Chinese medicine. I think their equivalent is qi. And at the very basic sort of physical manifestation of prana is like respiration, like where does energy flow? Because if energy is not flowing, you won't be breathing, and then life will not be present. So at least physical life, right? So again, all Marma points have local effects. So if you have pain in this area, upper back pain, pain in the neck, pain in the shoulders, pain between the scapula, this is a good point to work on. It helps with lungs, right? It's basically staying over the lungs. So things like congestion, bronchospasm, difficulty breathing, asthma, chronic cough, bronchitis, pleuritic pain can be helped at this point. Again, if there's an infection, the person's probably going to need antibiotics of some kind, whether it's conventional or herbal or something like that. So again, complete treatment plan, comprehensive treatment plan. This is just one tool in your toolbox to help yourself or others if you work with others. This point can also be helpful with the heart, so things like ventricular dysfunction and palpitations. This point's also good for emotions, especially grief and depression. So again, vata, kapha type emotions, because the lungs are very kapha. You need all that water to have the oxygen, carbon dioxide exchange, and all that air. So that's why the lungs especially are very windy and earthy at the same time. If you watched my Marma points on the chest video, you might remember the point apastamba, which is sits at the level of the second intercostal space on the front of the chest, and so this point has similar functions to apastamba, if you happen to remember that one. And so when somebody has a chronic pain at this point and a low-grade fever, that may denote that the person is experiencing tuberculosis. So these points can be diagnostic as well, besides therapeutic. So that's Amsa Phalaka. And then the last point here is Bruhati. Bruhati means expansion or support. The location, it's below the inferior angle, that little corner of the scapula. And again, it's bilateral, so you have two, one on each side. The energies associated with this point are the Pranavayu, the Vyana-vayu, the Samana-vayu, the Udana-vayu, and the Ranjika-pitta. Oh, I need to change that on my slide. It says Ranjika-vayu, I need to change. Hopefully I remember to do that before I upload this. In any case, this point is also good for prana, so life force energy and respiration generally. It has local effects, so pain in the intercostal space or interscapular space or lymph node congestion, things like that can be helpful at this point. Regarding the heart, it's helpful with the mitral valve. with lungs, you know, general support, respiration, difficulty breathing, shortness of breath. Because this is lower, it's going to start to affect other local structures such as the diaphragm. So if there's issue with the diaphragm, and it can be helpful with the liver, gallbladder, and spleen because they sit just right below the diaphragm. And this point is particularly helpful with anxious emotions. The point on the right side of the body is related to the liver and gallbladder. The point on the left side is related to the mitral valve, the heart, spleen, and things like splenitis. So there are different sometimes with the Marma points, whether they're located on the right side of the body or left. So that's Bruhati. And then just to summarize, again, all these points have local effects. So the Prishtas are going to be more helpful for the neck because they're closer, and Bruhati is going to be closer, is going to be more helpful with the diaphragm and digestive issues like liver, gallbladder, spleen, and immunology as well, immune system, because it's sitting closer to it. The throat, look at the Prishtas, the chest, all five points. I'm lumping the Prishtas together here. Heart, lungs, mind, emotions, all of these points can be helpful. And again, diaphragm, liver, gallbladder, spleen, Bruhati, because that's the closest. So ways to work with these points. So I did, as I mentioned, I made a video, Marma, on the hands, follow along. And that's where you just gently press with your fingers. Like sometimes that's all these points really need. So if you want an experience of that, you can check out the video. But there are other ways to stimulate and work with these points. So another way might be to use a warm or a cool pack. Now the thing is, which one, warm or cool? So sometimes it depends on the condition or the person's constitution. So if you do know Ayurveda and you can figure out whether, for example, pain in this area of the back is Vata or Kapha or Pitta, then if it happens to be Vata or Kapha, wind or earth, those are both cold. So to balance them, you could use a warm pack. If it's a Pitta related pain, so if there's inflammation there, then you want to cool that fire with a cool pack. But if you don't do Ayurveda and none of that makes sense to you or you've never heard of it, skip it. It's not that critical. There are a lot of other ways to work with these points. There's also Abhyanga, which is warm oil massage, and different oils. I actually did a video on natural oils and the different kind of energetics with that, so you can check out that video if you want to choose a base oil. And I have on my list to do a video just on Abhyanga. So hopefully that'll be in the works soon. And again, because these points are right sitting at the lungs and the heart, just by, one, meditating on any Marma points, like you're sending your prana, your life force energy, your vital energy to these points, and you're stimulating them energetically. Because again, this is an energetic modality. Okay. And you can also just take long, deep breaths. So like where you're really filling up the lungs and expanding your diaphragm. By expanding your diaphragm, you're going to be stimulating Bruhati. Yeah. So again, you don't have to get too fancy here. There are all sorts of ways to work with these points. Yoga, all sorts of yoga poses. So what are some yoga poses that would involve the upper back and shoulders? So things like fish pose, Matsyasana, camel pose, Ustrasana. So in both of those poses, there's like a slight back bend, but in the upper back, not in the lower back, right? It's in the upper back. So you would be stimulating these points by getting into those poses. If you do side plank or Vasisthasana or cow face pose, Gomukhasana, right? Side plank, you do plank, but you're just on your side and your one arm and that whole shoulder there is basically holding you up. I mean, that's a pretty strong stimulation to these points. Cow face pose, that's actually in the photo here where one hand goes over, the other hand goes under. Sometimes they touch, sometimes they don't. If they don't touch, you can get like a strap or a towel or something like that and hold, just work your way slowly, get your hands slowly over time closer to each other by walking, down the strap or towel so they get closer to each other. Once you're, again, you don't want to hurt yourself here, but just when your shoulders, if and when your shoulders become more open, that would stimulate these points. And then there's also happy baby pose. So you can be on your back and bend your knees and grab your feet or toes like a happy little baby, and then you kind of rock back and forth. So when you rock back and forth on your back, and you do want to kind of rock out, to the shoulders a little bit, you'll be stimulating these points. So especially if you're doing this for yourself, I find it very difficult to stimulate these points unless it's through something like this. Another, technique is you could lie and roll on a bolster, like a soft one, so you don't hurt your back, or an exercise ball, or you could put a cup, if it doesn't hurt your back or cause a headache or something, you could put a pillow under your back and just let your head go. And again, this is just from C7 to, about T12, so basically just where the ribs are, the top part of your back. And then your hips are below that a little bit, and then your head can hang off. And basically it's a chest opener. But you just lie there, and you can bend your knees. By bending your knees, you take the pressure off the lower back. So you can just hang out there, take some deep breaths. Again, it doesn't have to be long, 30 to 60 seconds for these points. And there you go. That's another way to stimulate these points and work with them. I also was... while I was putting this together, I realized, at least on my couch, I have a couch, and I have a pretty good arm on the couch where it's padded, so it's not like wood, just straight wood, but it's stiff. And I noticed that if I kind of lean back where the inferior angle of the scapula is kind of sitting on the arm, like Bruhati points. And then I just sort of lean to one side and then lean to the other side, and I'm kind of massaging. I find that I could massage these points by sort of leaning to each side slowly. Again, you don't want to dig your shoulder blades into your couch, especially if it's pretty stiff or hard. But if you do it gently, you could actually sort of walk your shoulder blades on the arm of the couch, and that's another way to stimulate these points. It was funny because when I was doing that, and then a few hours later, I was watching some movie, I think, and then suddenly started crying, and it was just sort of surprising to me because I wasn't thinking about anything. I wasn't having a memory. It wasn't a sad, emotional moment in the movie, and I was it just seemed out of the blue, and I was oh yeah, I was just walking my shoulder blades, on the couch, and here you go, emotional release. So I guess there were some emotions locked up in my shoulders. So that can happen, and just be present with yourself, let the old stuff out, and free up your energy for the new and good stuff. Yeah. So that's it. So 5 more points to add to your repertoire of Marma points. Hope you're working with these and finding them helpful. I also just briefly want to mention, I actually have another YouTube channel. It's on Vedic astrology though, so it's a different topic, although it's somewhat related, because again, Vedic astrology is the astrology of ancient India. So, and actually, yeah, there's actually overlap, but at least in the States, people see them as 2 different things. So I have a different channel. So if that's of any interest to you, it's called Light Vedic Astrology. You can check that out. I do, mostly right now, I'm doing monthly transit reports, just kind of, and then I look at world events and analyze charts of influential people and moments in time, political moments and different nations. And so anyway, if you're into that, you might check it out. But otherwise, I hope you're doing well, and I want to thank you for your time and your attention. And as always, I hope this is helpful to you. So until the next one, take care. Bye-bye.